You're listening to Cross Currents from KALW News. I'm Hannah Baba. Every day, KALW reports the number of new coronavirus cases in the Bay Area. But since there also aren't enough tests available to confirm every case, some people who experience symptoms are told by their doctors to stay at home and quarantine. Alexis Madrigal is a Bay Area journalist who writes for The Atlantic, and when he set out to report on coronavirus testing, he realized how inconsistent the numbers are across the country. Some states only report the number of tests that come back positive for the virus. Some states report everyone who gets tested, and some states are lagging on reporting testing altogether. Madrigal, along with a colleague at The Atlantic and a slew of other volunteers, started a website called the COVID Tracking Project. It compiles all the coronavirus testing data from across the country and corrects it for inconsistencies. KALW science reporter Marissa Ortega-Welch spoke with Madrigal about what data we do have, what data is missing, and what a lack of numbers means for fighting this pandemic.
Here we are in the middle of a pandemic. Why is this crowdsourced volunteer-run project the only source of this information?
In every other country, basically, the National Health Service does this. Like the equivalent of our CDC puts out a map of all of Italy's provinces and what's going on in these different places. And to be honest, we just sort of assumed that this data existed somewhere. In the U.S., it just didn't exist.
I mean, you're doing this national project, but you live in the Bay Area, so I'm sure that you're following that data pretty closely. What do we know in terms of the data for the Bay and what's missing?
Well, what's really interesting about the Bay is that we seem to be in fairly good shape relative to the rest of the country. It's a little bit hard to tell, though, right? And here's the reason why. If you look at the testing situation for California, over the last week, we've been averaging about 2,000 tests a day. I mean, we're the biggest state in the country, and that is a tiny, tiny, tiny number of tests. Probably the state that's doing the best sort of relative job of testing is New Mexico. And they basically have been doing the same amount of tests as the state of California, and you think there's, a few million people in New Mexico? So we really don't know what's happening. The only thing we know for sure is that a huge backlog has built up inside the state of California. And by this, I mean primarily at private testing labs contracted with the state of California. We just know that there's more pending tests than there are completed ones. So if those pending tests have a positive rate that's similar to those thus far completed, then California actually probably has the second largest state outbreak after New York. And I think we don't know, again, though, how those cases will then be distributed through the state on a county by county or regional basis. So it could be that the Bay is in tremendously good shape just by luck and by early action, or it could be that we're actually hiding a problem that will soon show up in the form of hospitalizations.
So on that note, last week, 6 Bay Area counties announced that they would require labs to report all test results, both positive and negative test results, to state and local governments. And I think a lot of people may have been surprised to realize that not all the test results had been reported before then. I didn't even take a statistics class, and I feel like I can guess that if you want to understand a problem, you have to know the positives and the negatives.
Yeah, I mean, the way we've just been talking about it is we need the denominator. You need to report all the tests, because if you only have the positive, that doesn't tell you the full story. It's not just it'd be nice to know how many cases there are in California or all the counties of California. It's that you need to be able to understand as quickly as possible where the hotspots are so you can direct resources to those places and really get moving. The other really, really important thing about testing, though, you've probably heard a lot about PPE, this protective gear that healthcare workers wear. So basically, the longer a test takes, the more PPE we burn through at the hospitals.
Because when we don't know if somebody is sick or not, we have to continue to assume that they are sick.
Exactly. If they have COVID-like symptoms, they have to treat them as positive until they get a confirmed negative back. And what that really means is this incredibly scarce resource that all these people are trying to find ways of gathering to bring to hospitals. Every day that goes by where we've got a test that's not coming back, or we're not able to get tests, we're burning through more PPE. And that's on a pure, why is it important to test and test fast? I mean, that's it.
Okay, so you just told us why testing is important for understanding what's going on within the hospitals, one reason. For those of us that aren't in a hospital setting, with shelter in place in effect, we are basically being told to assume that everybody has coronavirus and stay 6 feet away, right? So why else is testing still important?
Yeah, I mean, the thing is that less testing equals more aggressive social distancing measures, right? Basically the reason we're all having to shelter in place is because we have no idea how to actually surveil where things are, and that, you think about places that have really had a lot of success with this in East Asia in particular. And a lot of what they're doing is having a more open economy, a more open society, but with much higher levels of testing intensity. Here, because we don't have testing, we're faced with this problem of having to really shut down society because we just don't know any better.
A lot of news outlets now, when you turn on your radio in the morning or turn on the television, KALW included, we're giving the daily updates on coronavirus cases in our region. But you're saying that this data set is totally incomplete. Should we even be giving those updated numbers every day?
I've thought about this. I was on MSNBC over the weekend, and I was thinking about the way that they present this data as somehow conclusive, or this is the number of cases. And it's just clearly not. No one who has really thought about this for more than 30 seconds could conclude that that's the actual number of cases. I think the right way to look at this is that every case you see is just a newly discovered case. And it's just a subset of the total cases that will be out there. And in many places, people who have COVID-like symptoms are just told to stay at home, particularly if they're young. And they'll never be tested, and we'll never know. I think the other numbers that many experts feel are the truest indicators of the severity of an outbreak and its sort of prevalence are the hospitalizations and the deaths. I mean, honestly, that's basically been the problem through this whole thing for me is if you don't do testing, the way you know how prevalent the disease is you count the bodies. And that's kind of the options.
That was The Atlantic staff writer Alexis Madrigal speaking with KALW's Marissa Ortega Welch. This interview was co-produced by Sarah Lai Sterland.